Thank you for the opportunity to present my capstone project. My name is Eszter Hars, the President and CEO of the Shwachman-Diamond Syndrome Alliance. Like many rare disease leaders, this was not my chosen career. It chose me, and I simply chose to step up. I hold a Ph.D. in molecular biology in the field of cancer and leukemia. I have over 20 years of experience in biotech, including co-founding 2 biotech startups, managing FDA regulatory approval for medical devices, and managing customer relationships and business development at an IT company that was acquired by Elsevier, leading scientific publisher. While SDS has a lot of fundamental research in place, I found some significant gaps that stand in the way to therapy development. And the reason I got into this is my most important job, which is being the mother of a patient with SDS who was diagnosed at age 1. What is SDS? So Shwachman-Diamond Syndrome is a rare genetic disorder. It affects the whole body, but 4 categories stand out. It causes digestive problems, immune system issues, cognitive issues, and most devastatingly, problems with the blood-forming system, the bone marrow, including causing a high risk of developing leukemia. About 1 in 3 patients develop leukemia by age 30, and it is usually fatal. So having been part of the community for many years now, I can tell you that it's absolutely devastating watching friends go through this. And this is really the driving force behind our goal of developing therapies and cures for Shwachman-Diamond syndrome. For this capstone project, we focused on patient data resources. And the 2 areas we are focused on is finding more patients and collecting more data. So finding more patients means to engage more patients so that they participate in research more often and more deeply. And with more data, we mean data that is not already collected by other collection efforts. So we did a thorough survey of what data already exists. There's a number of academic registries that collect medical records and extract information from there. But what's not being collected is really the patient voice. So our overall capstone goals that we developed as part of the capstone project were to launch a patient-entered data platform designed for collaboration with the overarching goal of accelerating therapy and cure development. And the specific objectives are to serve to mobilize, unite, and energize the patient community, amplify the patient voice, and support clinical trial and therapy development, matchmaking, so to be able to match the right clinical trials to the right patients, and to catalyze collaborations with other data sources globally. The progress we made so far came straight out of these objectives. We prioritized including foreign languages from the start in both the surveys and the consent forms. The program is already IRB approved. We identified a suitable platform with an emphasis on patient friendliness. And we chose data elements and surveys, again, that are patient-friendly and yet are validated and structured in a way that they can support research and therapy development. We also focused our marketing and communication efforts to support these objectives. And finally, we set up the platform to enable collaboration. We intentionally kept all the doors open to be able to adopt GUIDs and tokenization tools of any kind, whatever our future partners can work with. The challenges we encountered and the advice I would give based on them is around just realizing how extremely resource intensive developing data resources is. And it is really a heavy lift for small teams like ours. And I just want to acknowledge that. Another challenge was that not everyone will see the value of this work from the get-go. And that's why being really clear about the goals and objectives is so important. Because if we're doing the right things for the right reason, others will come along eventually. And finally, patient data, or the goodwill of patients, is the most precious resource. We really have to earn their trust and work on it. And make sure that the data is used for the patient's benefit and goes as far as it possibly can. I mean, it's obvious to us patients that we want our data to benefit our children and our patients to the maximum extent. We are now ready to enroll patients in the pilot study, and our goal is to expand based on the learnings from the pilot to roll it out to the entire SDS community early next year. This is an effort truly by the patients for the patients. Thank you to the LeadersLink program for selecting us to participate. I'm extremely grateful for the learning from my fellow grantees and the impactful webinars, as well as the connections with my mentor who was assigned to me, and additional connections with a huge panel of experts in every area imaginable. I'm really grateful and appreciative of all the resources and want to extend a huge thank you.